Greetings and felicitation to Dr. Rangaya, Dr. Ramesh Dampuri and their team for an excellent combination of both pediatrics and the dermatology. It's like learn pediatrics and take home dermatology free of cost. Enjoy the session. Just a statement in the memory lane, it was way back in 1996, I had the honor of organizing the second Twin Cities Pedicon along with the state chapter. It was a good beginning for the IAP TCB, and now in these 20 years, IAP TCB has gone up very well. Today I will share a much simpler topic which is very, very important for all of us. That infection control starts with one of the finest equipment that each one of us are having, that is do no harm. Do no harm to the patient while you are treating the patient. It may seem strange principle, but it is a very important not to do harm in delivering the health care. What is infection control? It can be divided into hand hygiene, environmental hygiene, screening and cohorting of the patients depending on their diseases, giving appropriate vaccinations, good surveillance of the cases, and doing antibiotic stewardship, care coordination, follow-up of the patients, and also coordination with the departments and support with all the departments to do a good coordination. Comprehensive unit-based safety program has to be implemented if you have to do successful infection control. Why infection control is important? Because of hospital-associated infections which can occur in the patient soon after admission within 48 hours. Then hospital-associated infections which can occur up to 30 days when patient come back. They are the infections which have the origin in the hospital. And lastly, the healthcare-associated infections which can cause havoc, which can be persisting for longer time also. The prevalence, I need not elaborate, it is very, very well known. There is a high burden of infections. The resistant bacteria, particularly in the ICUs, the examples are there is a lot of resistance to vancomycin in India, and the detection of this New Delhi metallo-beta-lactamase, which is resistant to the carbamazepine, is a very alert note for us to prevent the infections in the intensive care areas. The dynamics of hospital infections revolves around number 1, the host, number 2, the agent, and 3, the intimate environment. It is a play between these 3 things that cause the infection and which helps in thriving of the infections and causation of nosocomial infections. How infection spreads? It spreads from patient to worker, the visitor and the patient, from the visitor to the patient, to the worker, healthcare worker, visitor and the patient, and always again from the worker to visitor and patient to the patient. So it's a vicious circle that goes on and goes on. Let us see in a hospital, whether it's small or a big, the infection control should start in the OP setting. And very importantly, strategy for infection control should begin as soon as the child comes to the hospital by segregation age-wise, segregating the healthy babies for immunization, and sick children separate, which we know in Gandhi and Nilufar, which is very, very difficult task because of the load of the, but still with new spaces and new units being created, it is possible to control the prevention at the time of entry into the hospital itself. Infection control in the outpatient to start in every clinic is a potential place for infection, and the contact between the contagious children and uninfected children should always be checked out and separated, and immunocompromised children who are attending for the clinics or the outpatient should be segregated, and parents and of such children who are immunocompromised should be taught of cough manners, cough etiquette, so that other siblings and other children coughing may not spread the infection. safe injection practices have to be practiced, and healthcare personnel should receive all the appropriate vaccinations so that the infection will not spread further. This is very simple but very, very important, is avoid close contact with people who are sick. When you are sick, keep distance from others, and aerosol spread of virus can go into the environment up to 50 feet and cause the infections, particularly the influenza. Infection control in the hospital. When we do our daily rounds, one of the best way to prevent infections is to use, most important practice is prevention of hospital associated infection is you do hand hygiene immediately before and after seeing each patient. This goes long way. It is practiced in PICU and NICU, but during the regular rounds also, it is very important to practice hand hygiene. Then standard precautions in healthcare settings, we know, thorough hand washing in intensive areas, washing in between the digital spaces, and all the steps of hand washing, which we already know should be enforced. Very important is the personal protection equipment like gloves, gown, mask, cap, eye protection are very important to give personal protection so that infection will not go from the healthcare worker into the patient and the vice versa. The safe injection practices have to be practiced to prevention of needle stick injuries and sharp injuries. So ensure safe injection practices in every time, in every setting is one of the important tasks to prevent the infections. Patient placement in the OPD is an important thing. This is a typical hospital, government hospital, the left slide, and you can see a lot of crowding, and it can be segregated like this. Optimum spacing should be there between at least of 1 to 2 meters to reduce the cross infection, and also children infected by same organisms may be cohorted together and separating from other children. This is a very important aspect of hospital management. This is now being outsourced in many hospitals. Environmental cleaning and management practices, that is good housekeeping, sanitization of the wards at least 4 times a day is mandatory, and keeping very hygienic and clean, and also the beds and the lockers, everything has to be thoroughly clean. What is important is handling the patient care equipment. Whatever you are using, the catheters, etc., as far as possible, use disposable equipment and discard them and autoclave. And one is important is laundering of the patient bed sheets, towels, etc., and sanitization is a good management of linen safety, goes long way in control of the infection. This we all know, particularly in a big hospital, may be beneficial for hospital-sized children. The dynamics of antimicrobial resistance is worthwhile mentioning here. It is a resistant bacteria which is judged by the infection control programs occurring in different places, and it has a very special significance for bacteriological occurrence of the resistant organism and also for the epidemiological studies. The determinants should be the patient, the organism, the drug, and the environment. The prevention of emergency infection is one of the goals for infection control in the hospitals. The goals of prevention and strategies should be optimal use of antibiotics, which we all do. It happens in a big hospital, the assistant professor and professor make rounds, gives an antibiotic. Tomorrow when they come to the rounds, our postgraduates dynamically, they change and escalate the antibiotic, which may not be rational. It is being done in the hospital. That should be avoided. Optimal use of antimicrobials, national protocols of common infection should be followed, what are being done in big institute, not to go haphazard, and restriction policy, selective removal of drugs which are duplicated are given again, and antibiotic cycling and scheduled antibiotic change after certain days to prevent resistance should be there. And lastly, combination of antimicrobial drugs to prevent the emergence of resistance, like in what we give in HIV and tuberculosis, is very important. All the hospitals, whether small or big, private nursing home, should have institution of hospital-based infection surveillance team consisting of a pediatrician, microbiologist, an administration and also an epidemiologist. They should sit frequently and discuss the antibiotics what are being given and do the audit. Periodic swabs cultures from the healthcare workers should be done, and cross-checking with the antibiotic grams, what we do routinely, the blood culture, throat swabs, etc., with the reference laboratory, and also antibiotic auditing has to be done in all the case sheets, and escalation and de-escalation of the antibiotic is very important aspect. Wherever child is improving, probably is the right time to de-escalate, and wherever need be, do it judicially and rationally. Strict institutional infection control policy and its implementation is a priority for infection control. It will go a long way. Now let us see 2-3 scenarios of infection control in the intensive care unit. We see, and we are in so much hurry that the infection is occurring. But are we following all the procedures to prevent infection to the intensive care child? Let us see quickly 2-3 scenarios. Hospital-acquired infections in intensive care units constitutes about 25 to 30% of the HAI, and because ICU patients are the consumers of very, very high value antibiotics. So we need to be more vigilant in those places. Common infections in the ICU are disease, bloodstream infections, VAP, pneumonia, ventilator-associated infections, and catheter-associated infections, and surgical site infections. These are all responsible for significant mortality, morbidity, and hospital duration of stay, and also resource utilization, which is a very costly thing. So how should we go forward? What are the challenges? Now there is an approach, what is called, there is got a bundle approach for catheter infections, bundle approach for the vaccine-associated infections, and bundle approach for the bloodstream infections. And we have got the bundles, we know the germs and how we should do it judiciously. Prevention of bloodstream infections by thorough implementation of the preventive measures with a bundle approach of using gloves, sterile precautions, taking care. The catheter which we use as the child comes, the first thing we use is a catheter. Though the technology has changed and we are more aseptic now, we should make it totally aseptic and sterile. We see in our hospitals, day 2, day 3, it gets blocked, thrombophlebitis, cellulitis, etc. So catheter-associated infections can be prevented with a good bundle approach. Next common is the urinary catheter. And the study has shown that catheter infection rate has been reduced from 7.7 to 1%. Even the policy of antibiotic and infection control is manifested in the institutions properly. Then catheter-associated infection, urinary tract infections account for almost 40% of the hospital-acquired infections. Most infections are due to urinary catheters and leads to increased morbidity and cost because of subsequent urinary tract infections in the patient even after the discharge. What are the strategies to prevent the urinary tract? Avoid unnecessary placement of the catheters, and also remove catheters as quickly as possible, and alternative condom catheter, intermittent bladder can be practiced wherever possible. Aseptic technique in catheter insertion should be followed. Appropriate catheter maintained, good antibiotic therapy, and different catheter compositions need to be implemented. The main principles of catheter-associated infections, number 1 is avoid unnecessary catheterization. Number 2, limit the duration of catheterization in a child who is in ICU. Lastly, prevention of ventilator-associated pneumonia. We should be geared up because these are important. It will have long-term consequences. Periodic bacterial monitoring policy, as I have told. And secondly, specific prophylaxis, use of personal protection equipment. Wherever possible, give non-invasive positive pressure, minimize duration of MV, and check daily for readiness. These things to be adopted very carefully, and ventilator bundle approach should be there for each ending. A group of interventions related to ventilator care, when all interventions are applied simultaneously, there is enhanced reduction in the incidence of VAP when each intervention is implemented separately. As a team, they need to be implemented. What this bundle contains: head elevation, daily sedation, peptic ulcer prophylaxis, deep vein thrombosis prophylaxis, and daily thorough oral care of the child who is in intensive care, and subglottic suction. Ventilators: eat clean, disinfect, and use properly. Sterilize. Reusable contents which are disposable, please change it. Even the OPDs, if you are using nebulizations, please see they are probably decontaminated and used again so that we will prevent the infection. These oxygen masks, very important. Change oxygen mask and tubing between patients more frequently if they are soiled, and decontaminate them every time. Key prevention strategy for infection control will go a long way in survival, cost, etc. And what we have to do is diagnose and treat properly, use rational antibiotics, and prevent the transmission from person to person. And conclusion is, infection control is a vital component of healthcare system of any institute, big or small. Good infection control policies ensure good rating and enhance the reputation of the institute. Infection control is not an opportunity but a dedicated responsibility towards the child under the care, and let us show strong leadership and collective team. It needs a collective team right from the head of the institute to the class 4 employee to protect the children from infection. Friends, clean hands are beautiful to the world. Infection control is truly in your hands. The compassion towards the child, the excellence in the work, the respect towards the mutual persons, and also the justice to the child, and last but not least is a good stewardship is important in the prevention of infections. Thank you all. Thank you for the time given.
Like and subscribe Eagle Media Works.